As a Kenyan, patriotic to my beautiful country Kenya, I wish give my own view on universal healthcare. Health. This is a personal reflection and proposal. Just read, listen, and let us make Kenya great every day. If you have other suggestions, let me see them in the comment section. Let us think together. Proposal for a simple and applicable universal health coverage, UHC, for Kenya. 1. Introduction. Kenya's health sector faces challenges in providing equitable, affordable, and quality health care to all citizens. To address this, the government must establish a universal health coverage, UHC, model that is simple, efficient, and applicable across all population segments. This proposal outlines a yearly-based UHC system categorized into different population groups for optimal coverage. 2. Objectives. Provide equitable access to healthcare for all Kenyans. Ensure financial protection against health-related expenses. Improve efficiency and sustainability in healthcare financing. Enhance preventive, curative, and rehabilitative healthcare services. 3. Structure of the universal health coverage system. The proposed UHC system will be structured into the following key components. A. Population categorization and coverage mechanism. To ensure inclusivity and affordability, the UHC system will be segmented into different population groups with specific funding mechanisms and benefits. Vulnerable and indigent populations, children, elderly, persons with disabilities, and low-income households. Coverage. Fully government-funded healthcare through taxation and international donor support. Services covered. Primary care, maternal and child health care, emergency services, chronic disease management, and rehabilitative services. Funding source. General taxation, sin taxes, alcohol, tobacco, corporate social responsibility funds, and international grants. Formal sector employees, both public and private sectors. Coverage. Mandatory health insurance contributions through payroll deductions. Services covered. Comprehensive health care including specialist consultations, hospitalizations, and long-term care. Funding source. Contributions from employees and employers, percentage of salary, supplemented by government funding for high-cost treatments. Informal sector and self-employed individuals. Coverage. Voluntary contributions to a National Health Insurance Fund, NHIF, linked scheme with government subsidies. Services covered. Outpatient, inpatient, maternity, chronic disease management, and preventive health care. Funding source. Graduated premium payments based on income levels, with subsidies for low-income earners. Farmers, fishermen, and other rural workers. Coverage. Community-based health insurance, CBHI, linked to NHIF. Services covered. Essential health care, vaccination, and emergency services. Funding source. Seasonal premium contributions based on earnings, supported by government subsidies. Students, primary, secondary, and tertiary. Coverage. School-based health insurance programs integrated with NHIF. Services covered. Preventive health care, minor treatments, emergency care. Funding source. School fees allocation, parental contributions, and government funding. Rationale. Students should be treated free of charge to ensure access to health care does not interfere with their education and to promote overall public health. Senior citizens, above 60 years, and vulnerable populations. Coverage. Fully funded by the government with no out-of-pocket expenses. Services covered. Geriatric care, chronic disease management, home-based care. Funding source. Pension fund allocations, government budgetary allocation. Rationale. The elderly and vulnerable should receive free treatment due to their limited earning capacity and higher health risks. Consequences. If they are not treated free of charge, it could lead to increased mortality, social inequities, and a greater economic burden on families and communities. Emergency medical treatment for all. Coverage. Free emergency medical treatment for anyone, including unregistered citizens, legal and illegal immigrants, and villagers who may not know about health cards. Services covered. Emergency trauma care, accident treatment, life-threatening conditions, and childbirth complications. Funding source. Government Emergency Health Fund, donor agencies, and humanitarian organizations. Automatic registration. Patients receiving emergency treatment should be automatically registered into the UHC system without paying for the treatment received. Beat budgeting and reimbursement for health services. To ensure continuous service delivery and prevent strikes or service discontinuation, the government should adopt a structured budgeting and reimbursement system for both public and private hospitals. Annual fixed budget allocation. Hospitals should receive a predetermined budget allocation based on the projected patient load, service complexity, and operational costs. Capitation model. Government hospitals should receive per capita funding based on the population served, ensuring predictable financial support. Performance-based funding. Both public and private hospitals should receive funds based on service quality, patient satisfaction, and efficiency in delivery. Timely reimbursement. Private hospitals providing services under the UHC scheme must receive reimbursement within a specified timeframe, e.g., 30 to 60 days, to avoid cash flow problems. Emergency fund reserves. A national emergency healthcare fund should be established to cover unforeseen healthcare crises and prevent funding shortages. Developed country models. Countries such as Canada and the UK allocate hospital budgets annually and adjust funding based on periodic reviews. Kenya can adopt a similar approach to ensure financial sustainability. See role of doctors and other health workers in universal coverage. Healthcare workers play a crucial role in delivering quality services under the UHC system. They should receive adequate compensation, training, and resources to improve service delivery. The government must ensure that universal coverage does not negatively affect the quality of healthcare services by providing sufficient funding, staffing, and infrastructure. A well-structured healthcare workforce will ensure patients receive timely treatment without bureaucratic delays. Health identification cards and streamlined access. Universal health cards. Every citizen should be issued a biometric health identification card linked to the UHC system. Automatic registration at birth. Health cards should be issued immediately after birth and linked to the National Identification System to ensure universal coverage from infancy. Accessibility of cards. Health cards should be available at designated government offices, hospitals, local administration offices, and online platforms. Digital integration. The card should be linked to a digital database allowing instant verification and access to health benefits. Simplified access. Patients should present their cards at hospitals and receive immediate treatment without approval delays. Interoperability. The system should work across public and private health facilities to ensure seamless service delivery. Data security and management. The government should invest in secure health information systems to protect patient data while enabling efficient service provision. E-governance and implementation framework. National Health Commission, NHC, overseeing policy formulation and implementation. County health boards, managing decentralized healthcare provision and monitoring. Public participation and stakeholder engagement, ensuring transparency and inclusivity in decision-making. 4. Expected impact. Increased healthcare access for all citizens, reducing health disparities. Financial protection against catastrophic health expenditures. Improved healthcare quality and efficiency through a well-funded system. Sustainable healthcare financing with equitable burden sharing. Immediate access to healthcare services without bureaucratic delays. 5. Conclusion. This universal health coverage model presents a simple yet practical approach to ensuring all Kenyans receive quality healthcare. Through strategic funding, structured coverage, and robust governance, Kenya can achieve a sustainable and inclusive UHC system that enhances the overall well-being of its citizens. Thank you for listening. Let your opinion be seen in the comment section.